two area in the mid-clavicular line, one here and one here, one towards the base of the lung. So three area in this, three area in this. This is for the total lung examination. What we are going to see here is lung sliding sign. So this is what you are seeing is very simply, that is one rib shadow here and a rib shadow there, and what you are seeing is the lung sliding. Okay, and when he is breathing, it's very clearly sliding. Most of the examination of the lung is based on lung sliding and how does it look below it. So this side and this side are similar. Can you take a deep breath, Julius? Okay, you can see, okay, small one, all right. You can see how clearly the sliding. Take a small breath. You see, this is the lung sliding. This is one rib, that is another rib. In between, what you are seeing is the external, external intercostal or internal intercostal. We'll talk about that during the intercostal block. The intercostal muscles, and below that, skin, subcutaneous tissue, muscles, and the first bright structures in between the two ribs are is the pleura. This is the sliding is occurring. The visceral pleura and parietal pleura are sliding over each other, on each other when the patient is taking the breath. So now we'll go for the cardiac exam. As you know that we will go really deep for the cardiac examination point of view. Anesthesiologists are more and more getting involved with cardiac echo to know their own patient's heart conditions prior to surgery. This is the best thing an anesthesiologist can learn from. So we will, in the due course of time, we will know the left heart functions and right heart functions separately, volume status and whatnot, regional one motion abnormality, diastolic dysfunction or HFnF, preserved ejection fraction, heart failure. All those details will go in due course of time. So first thing, for an echo novice, what you do is you put your probe just over the sternum, and once it is over the sternum, you see nothing, it's a bone. Once you come laterally, a little bit on the second or third intercostal space, you see the pulsating structures. So this is the parasternal long axis view. My pointer is towards his right shoulder, and I'll just decrease the depth of the screen. So what you are seeing is the parasternal long axis view. So if I keep this probe here and I'll just rotate the probe pointers, what I'm doing is rotate the probe pointers to the right shoulder, you get a different kind of view. So this is the short axis view. So you see all the left ventricular function in this view. So left ventricular function, papillary muscles, and blood flow, and all those things. And if you go in and in and in, you see till the apex of the heart and towards the leg. My direction is towards the leg. If I come out and come out and come out and come out, what you see is the short axis aortic valve view. So here you see all the chambers of the heart together, especially the VSD, ASD studies can be done here. So here is the aortic valve. In the center of the screen is the aortic valve. In a clear picture, you can see a Mercedes-Benz like sign, okay, in the center of the screen. And here is the left atrium, this is the right atrium, and this is the right ventricle. If it is right ventricle, this has to be the right ventricular outflow tract. So, so these are the normal structures and the views you are getting in the heart examination. We'll go one by one with different episodes, much more details, what you are going to get it. So to complete that, we are going to see can you just be this side a little bit? Yeah. Just to see the four chambers of the heart, okay, the maximum point of impulse, and you just increase the depth of the screen and you see the four chambers together. So what you do, you put the probe in the apex and find out the proper place. This is the four chamber view, okay. We are doing extempore. We have not seen, this is the first time I'm putting a probe over this patient. So no practice. Whatever you are seeing is without any addition. So basically, you know, this is the left side of the heart. This side is the left side of the heart, and that side is the right side. Okay, so left atrium, right atrium, and this is the aortic flow tract or left ventricular outflow tract. So use of Doppler, seeing a good heart, bad heart, and size of the left ventricle, PE, right ventricular size, pulmonary hypertension, that is the tricuspid valve you are seeing in the left side, and the mitral valve is the right side. So everything, and you can see a bit of descending out on the left atrium side. So basically our aim is to get as much as information from the echocardiography for the anesthesiologist, and gradually we'll go for liver, kidney, and all those things. What are the basic things we need to know? Now, in the next episode, we'll go for facets joints, cervical spine, thoracic paravertebral, whatnot. I mean, intercostal, everything we'll cover one by one. Thank you very much.